to you and your listeners.
I hope you're well.
I'm doing well by the grace of God.
First, I understand you're out of the country.
Absolutely.
Oh, okay. What has taken the General Secretary of the Ghana Registered Nurses and Midwives out of the country at this time when a strike has been declared?
Okay, so um, I'm in Helsinki to be specific, and I'm attending International Council of Nursing conference, which is held every 2 years. So this should tell you that it's not just a travel that is intentional. It is known. And you know how visa is acquired in Ghana. I know what people are saying. Oh, they ran away and all that. Look, those propaganda can sit somewhere. We are very decent professionals. We know what we're about. So I'm here to discharge international duty. As a matter of fact, we are selling Ghana here. And let me announce it to the hearers of your people that even Madame Perpetual Furampofo has been elected onto the International Council of Nursing Board to represent the whole of Africa. So we are selling Ghana here. We did national parade, and I was in my kente cloth, and come and see how the white people were clapping for Ghana. So we are selling Ghana as well.
Great. Having said that, and I'm guessing you are in touch with the rest of the executives that are in Ghana. What's your understanding of? Because I'm wondering, are you part of the council's deliberations on whether or not the strike should continue, or maybe bring an end to it whilst engagements continue? Are you part of those deliberations whilst outside the country?
Absolutely. We are in constant touch. You see, the fact that we've traveled abroad doesn't mean anything. You know, we are in a global village. And last night, we held both National Executive Committee meeting and National Council meetings. And it ran up to about 2 a.m. Geneva time. So we are very much in constant touch with our people back home.
And that meeting, I guess the discussion was still about the strike. Any news?
Well, we think that we are not being treated fairly. There is so much disinformation. There's so much misinformation. I just heard the statement from the finance minister, the deputy finance minister to be specific. I don't know the variables they captured into that calculation that ballooned the requests to 2 billion. And if you can permit me, I've seen some people saying all manner of things. Look, let me tell you, if you pick our condition of service, the issues in contention is only found at Appendix B. There are 8 itemized issues that we're talking about. And I, for the life of me, I cannot just understand that can amount to this huge sums of money. But I'm seeing a tall list of items. Funeral grant, look, those things are not part of our key ask. What has brought us to this level is institutional specific allowances, not those fuel grant, vehicle maintenance allowance. Those ones are open to all public sector workers, and it is not even negotiated by Ghana Registered Nurses and Midwives Association, and it is not. It is negotiated by Public Stand Joint Committee, okay, PSJSC. So for all workers, I've seen height allowance, I've seen disabled assistant allowance. Where from this misinformation? Height allowance, do nurses climb any building? It's meant for somebody who works in the public sector, like maybe an electrician or a carpenter or anybody who works. And if you're a nurse, you're not entitled to such a thing. Disabled allowance, disabled assistant allowance. For instance, if somebody is a nurse and she's disabled and an individual pushes that person to the hospital, it is that person that received that allowance, not even the nurse, let alone to say that it's going to another nurse who is pushing the disabled nurse around. What are you doing to ourselves as a people? So to answer your question specifically, the chief executive of Fairways and Salaries Commission met our people and they tabled a proposal. And it's not different from what was articulated in the press conference that was held yesterday at the Jubilee House, we think that they are simply being unfair to nurses and midwives in Ghana. Number one, I do not understand for the life of me why our concerns were not captured in the budget. Because this was supposed to have been paid 1st July 2024. For one reason or the other, which I will not fault the employer, and I'm saying employer, I'm not saying government, because some of our people, not my association, but some few nurses out there who are not party to this action, truncated the process through a court injunction, claiming that they wanted to assert their rights under Regulation 10 of the Labor Regulations, 2007. I don't begrudge them. But by January 2025, we had settled everything, and we have presented the out-of-court settlement to the court. And then we went back to the various ministries and served them, if you like, the out-of-court settlement, the judgment that was adopted by the court. So right from January 10th or 15th thereabout, we had reminded the chief executives, or if you like, the chief directors of the various ministries, finance and health, about the pendency of the non-implementation of our condition of service. They told us that it's not an old document. It's not a new document. It's an old document which sits at the office of the finance minister, because it was almost at the precipice of implementation. So we should give them some time for the new ministers to be sworn into office. I said, it makes sense. There's a new government. As soon as the ministers were sworn into office, we went to them and they told us that, look, we're going to read the budget. So just give us the opportunity. Constantly, almost on weekly basis, we went to their offices. And if you read the account that was given by the spokesperson for the Ministry of Health, he even alluded to the fact that we met more than 6 times. So I cannot just understand for the life of me if anybody thinks that a nurse or a midwife in Ghana is important and will either deliberately or inadvertently decide not to add our condition of service to the budget. Now, the proposal that was tabled was that it wasn't captured in the 2025 budget, and for that matter, it can only be taken care of in 2026. My brother, this is simply untenable. This is unacceptable, and we made it clear to them, and we said that, look, we will not agree to that. And that is where we are. And we are still on strike. And as a matter of fact, we are not happy, my brother. I've done this job for 24 years. I understand the value of human life even more than people who work outside the hospital. Because, you see, we are all human beings. But when you see life and death on a daily basis, and you know that life is only one, when it is lost, you can't bring it back, you appreciate it the more. I worked in theater for 18 solid years of my active working life in the hospital. Cumulatively, I've worked for 24 years in the health sector. We cherish our patients. We cherish the good people of Ghana. Some of us have not traveled out of Ghana because of the love for country. There is a new government. We need to support this government to put in the necessary systems to build this country. We will not do anything to derail the progress that we have set for ourselves. But it's unconscionable for anybody to think that they can play with the lives of nurses and midwives. My brother, this is systemic. That's why I talk about employer. I don't talk about government, because government will come and go. The employer still remains the same. I think that we are not being treated fairly. They are not sensitive to the plight of nurses and midwives. If there is any time that we had to even pay a little attention to nurses and midwives, it's this time, because most of our colleagues are living in droves abroad. So if you ask me, my simple answer is that the strike is continuing. Yes, we have cited a substituted service after they failed to serve us the interlocutory injunction. We cannot bring ourselves to contempt of court. We are law-abiding citizens. but we will go according to the express dictates of the content of that substituted service. And if you are minded, find a copy of the substituted service and read the last sentence of the last paragraph. If the government will hide behind technicalities to undermine the economic interests of nurses and midwives in Ghana, then we will also go strictly by the express dictates, I repeat myself, of the content of the substituted service. We are not ignorant people. The days where people thought that nurses, they are all females. Look, go to the University of Ghana School of Nursing and Midwifery. We have more than 40 people with PhDs. We have several professors. So the nursing that we knew of 50 years ago is not the nursing that we have in Ghana today. We run PhD programs at School of Nursing right now as I speak with you. They run in there. So we need to reorient our minds about the nursing and midwifery professions and the practitioners of same. If you travel abroad, look, as I'm here, I'm meeting people who want nurses. And I have to bring this to the attention of the minister. I'm meeting very senior executive managers of nursing and midwifery in other countries. I don't know whether they intentionally brought them here to come and, prospect for nurses and midwives. And they want to even run an agreement with us. I say, well, I can't sign any agreement on behalf of the government of Ghana. When I go back home, I'll walk to Mr. Akando and bring some of these proposals to his attention. Ghanaian nurses are sought after. I'm meeting executive directors from various countries in the world. ICN is made up of over how many? Several millions of nurses and midwives.
I want to find out from you the substituted service that you've seen. You're talking about going by the dictates of the orders of the court. I haven't seen that. My listeners have not also seen that. So please tell us what that is asking you to do.
Okay, so I'm not a lawyer. I'll not pretend to be one. But after all, sometimes some of the things is based on even the objective man's position, in law.
And I believe the GRNMA is a big association. You have your solicitors, so they would have advised you as to.
Obviously, we have lawyers. We have even practitioners who are lawyers. We have several nurses and midwives who are lawyers.
Great.
And we have consulted our lawyers as well.
Okay. So what are they telling you?
Oh, as far as we are concerned, that's what I'm telling you, that we don't bring ourselves to contempt to the court. But we'll go strictly by it. But we are not calling off the strike action. The substitute service doesn't mean, of course, it says you should bring your action to a halt. All what it seeks to do is to empower, if you like, the plaintiff to be able to serve you in other forms of ways. So, for instance, if the victim client is not in the jurisdiction and therefore he cannot be served, what other way can he be served electronically? What's blah blah blah? Yeah. So you take the leave of court and then you're able to do that. But I'm telling you that if you can avert your mind to, if you haven't seen it, there's a sentence which says that it is deemed to have been served after 14 days of being posted. So we are going to go strictly by the express details. For the risk of repeating myself, because I think that we are being treated unfairly. Why do you put out such a proposal?
No.
If anything, look, they can decide that okay, the thing is supposed to take effect from 1st July 2024. Okay, it's signed and sealed and delivered. We can't, and this is an agreement. I call it collective agreement.
I'll come back. I'll come to that because you seem not to be happy with that. But you're saying, and I want to understand this, because a court has made an order. Has that order been served on you?
That's why I've told you that whether it is served or not depends on the content of same. And I have alluded to the fact that we will not bring ourselves to the contempt of court. And for that matter, we will go by the exact, writings of whatever is found in
Is part
the
of that
subsistence service.
writings, is the court asking you to put, you said the court is asking you to halt the strike action, right?
In fact, the interlocutory injunction requested us to do the same.
Okay. And that's been secured by the National Labour Commission, I believe.
That was secured by the National Labour Commission as we anticipated, because it's a blueprint. The employer will renege on his responsibility, and then when you take any cause of action, they will go to Labour Commission, and then when they go to Labour Commission will go to court and enjoin the process, and then we go in circles. And that is how we have treated nurses and midwives in Ghana, and we have remained impoverished, and people can't see any light. Okay, the future is so bleak for nurses and midwives in Ghana. The current generation of nursing leaders will change the narrative, even at so let's leave it there about as far as the subsistence service is concerned. I think I've told you that we will go by the express dictates of the subsistence service. We are not ready to bring ourselves to contempt of court, and that is where I can go, how far I can go.
Mr. Tinkrang, you're essentially telling me that you've seen a loophole in the substituted service that you saw, and you are going to exploit it as much as possible.
I have not said that. Those are your kind words.
But that's what I hear.
Those are your kind words, senior.
I see.
I could have said that. I could have said that easily.
But do you recognize the power of the National Labour Commission?
Oh, my brother, why not? We recognize the power of the National Labour Commission and the court. That's what I'm saying, that we not bring ourselves to contempt of the court, but we go strictly by the express dictates of the subsistence service.
Because you talk about the conditions of the nurses, and I'm guessing that those conditions can only be improved through constant labor negotiations. Of course, the agitations are also tools that are available to you. And key to these negotiations are the Labour Commission, the courts, the Fair Wages and Salaries Commission. That's why I'm asking you whether you recognize the importance of the Labour Commission, even the Fair Wages Commission, to your aim to improve the conditions of the nurses.
And brother, let me tell you something. You see, when you come up with a collective agreement, it's binding on both parties. Both parties have no right whatsoever to tamper with the agreement until its full implementation. Now, if you have any difficulty with the agreement, there are express provisions in the agreement that states that even 1 year into the life of that document, which is a living document anyway, because it has expiring dates, you can embark on what is referred to as a wage opener. That is 1 year into the implementation, and I'm choosing my words very well. Not 1 year into the deferment of the implementation, 1 year into the implementation. If both parties don't find anything wrong with the document, 2 years, the document expires, and each party has within 1 month to notify the other for renegotiations. Our document expires in 2026. And you are telling me that you want to defer payment of the 2024 condition of service to 2026. Automatically, I miss out that window of negotiation that would have accrued to me in 2026. And it goes without saying that you are perpetuating the wrongful act against those cadre of professionals. And I'm saying that we have had this back and forth. 2016, we had a similar negotiations. We came up with a collective agreement. It saw no implementation. So 2 years later, 2018, the then president, Dr. Santikobia, said there's no need to go for renegotiations, even against our decision. But he was the president, and we accorded him that respect. But it was true, because if I had negotiated something in 2016 and it wasn't implemented, why should I go again in 2018? So when we came to office in 2020, that was when we went for negotiations. And thankfully, chunk of it got implemented, except 2 items. And it's featured in the 2024 negotiations as well. So, my brother, it's been systemic failure of the employer refusing to pay attention to the demands of necessary life. And let me tell you that every other health worker in Ghana is enjoying the same condition of service that we are talking about, and even better. And I think that, let me help the employer. They should forget about deferment of the payment. We are not asking everything to be paid at a go for it to, if you like, break the backbone or destroy the economy that we want to build together. We can stagger the payments. So if there are, let's say, 8 items or 6 items, monetary wise, and what is burdened on controller is about 4, why can't we look at 2 and implement it maybe next month, next 2 months, and stagger the rest? Okay? But be mindful of the arrears that has accrued. So in order to say that, oh, when we cough out 2 billion, which I doubt anyway, because I know they've added some variables that are not even part of the key ask.
Okay.
Instead of doing that to break the if you like, the back of the economy, stagger the payments and pay the arrears over a period of time.
But Mr. Tinkorang,
we can spread it.
What you're saying,
Yes.
you're saying it to Senna, the listeners of Radio Gold and the viewers
Absolutely.
who are not part of the negotiations. Have you suggested this to? Is it part of a proposal you're putting before government?
My brother, there is nothing that we haven't suggested to the government. In fact, in that meeting, our people suggested same. That was where the chief executive said they have to call up the strike before the negotiation table. And we are saying that we are not at the negotiation table. I know that if you are at the negotiation table, you cannot call for a strike, or you cannot negotiate when you are in a strike. We are not at the negotiation table. I want to make this clear to every Ghanaian that we have finished with negotiations. Where we are is implementation. For instance, if you want us to have a conversation about how the processes of implementation, that is not negotiation. Negotiation is when you sit down with the employer to, put a proposal across. This person will bring his proposal, bring a counter proposal. You come out with an agreement. We have gone past that stage. We have a collective agreement that is binding on the employer. If, for instance, they want us to have a conversation about the implementation, it makes sense. But that sort of being legalistic and technical to say that if you are at the negotiation table, you cannot go on strike. I'm saying that we are not at the negotiation table.
Great. Because, okay, so you said you can have a conversation on implementation. Is that not the conversation that you had, is it 2 days ago or something? Was it not about implementation? Are they trying to renegotiate with you?
Deferment could amount to a renegotiation. Deferment of payment, which take the semblance of a route of implementation, could mean a renegotiation.
Oh, okay, so you see deferment as a renegotiation.
And I think that's because I've told you that our document expires in 2026, and we have a window of opportunity to go for renegotiation in 2026. So if you defer my payment to 2026, I lose out of that window of negotiation. That is what we are talking about here.
Okay.
That's exactly what we are talking about here.
Mr. Tinkorang, we have to bring this to a close. I want to find out from you, what would it take for you, 1, to call off the strike, 2, to go back and have those conversations around from what time the implementation will begin?
Brilliant. I'll not be surprised you attended my secondary school or the university that I attended. Very simple. What I'm trying to humbly suggest, and don't let anybody think that we are being intransigent, we are being belligerent or something. Humbly, is that government should come up with a well-constructive, purposeful proposal that will inure to the benefit of nurses and midwives. And to be specific, they should start the payment of this arrears from, say, 1st July 2025, if they say that it's not in the budget, they can do a supplementary budget, okay? And then pay some of the items, the things that we are asking, and stagger the rest for a period that is agreeable to both parties, which will not also burden the economy. Because, my brother, I don't want this economy to be destroyed. I want to support this government to build this economy so that my nurses and midwives will not run away. Now that the dollar is coming down, some people want to come back home. So that's why we want to improve the system so that those who want to come back to help us with their newly acquired skills and competences to come back home. Because I took somebody to Western University. Today, she's a nurse manager in the United States doing exploits. I would have wished that person that I sent to UGMC will come back to UGMC to offer those kind of expertise. Quite a number of nurses and midwives are abroad. They are quite experienced. We met them, some of them at Helsinki. They want to come back home to come and help in terms of research, in education, and all that. Even to volunteer.
Great.
But we need to improve the conditions back home
so
that
you're telling
can come back. So
you're telling us that government has okay. So you will agree to call off the strike if government gives you something.
Absolutely. Why
they must agree
should we allow
to some
Ghanaians
payments?
To die? Absolutely. And I'm not saying that government should pay everything to us. Well, if you do that, we'll be wicked. I mean, my brother, listen. Nurses and midwives are not immune to diseases and ailments. As I speak with you, there are nurses who are pregnant who might even require cesarean section and stuff like that. There are midwives. Every family has a nurse. You see, the point is that it's not like we are happy going on strike as if we don't fall sick. But my brother, do you know that if you're a nurse or a midwife in Ghana and you fall sick, you have to go out of your pocket to pay for your medical bills? Are you aware of that? Even when you have acquired a disease condition as a result of your occupational related ailments. That is why I called the call by the request by the sector minister for retired nurses and midwives to come back to volunteer laughable. They are more angrier than us because the state did not treat them fairly. Look, let me tell you, we also recruit retired nurses and midwives. They are part of the Ghana Registered Nurses and Midwives Association. We extend something we call life membership to them. So long as they are alive, they are still our members. And anything that accrues to an active member accrues to them as well, as far as the union welfare systems are concerned.
Okay.
So they are members. So if you say that those members of us should come back, they will not come. And as a matter of fact, no, of course, they are very reasonable people. None of them will, after serving for 39 years and going home with a paltry 80,000, 90,000, 100,000 Ghana cedis as retirement package, will come back and give anything. Look, we should stop these things. It happened in 2016. I remember 2015. I remember doctors went on strike, and at that time, my good friend, the minister at that time, said, this fine gentleman, they wanted to mention his name. I mean, he said, they are going for retired doctors to come, then they are going to import doctors from Cuba. Look, let's stop this nefarious activity. Let's stop this kind of tactics, which is propaganda-driven. Let's face the facts. Let's call people to the table, have a very constructive, a well-intentional plan. Do you know what pains my heart? Because see, all this while that we were chasing Mr. Kando and the finance minister, they kept assuring us. They should have told us that, Charlie, the thing is not in the budget too. They should have told us from day one that, Charlie, we failed to put it in the budget. So that we could have, at this time, we could have reported that to our members long ago. Our members felt that our follow-ups was going to bring something better to them because we were also assured. Just give us a little time. I'm talking to the minister. The minister has traveled abroad. This. We have traveled abroad and they are talking. You know the number of times Akando and the minister traveled whilst we were chasing them for them to implement the condition of service for us.
Mr. Tinkorangt, let me conclude by asking, because you started by saying you're seeing some disinformation and misinformation. You said,
absolutely.
You said there are eight itemized issues that are aligned to your professional work. What are those specific demands so that to deal with the disinformation and misinformation you're talking about, the eight?
The 8 items?
Yes.
Okay. Just briefly. Number 1, we talked about fuel allowance. And the full allowance is not to every nurse or every midwife. In fact, we requested that every nurse, every midwife be given full. They didn't. They peg it at principal nursing and principal midwifery officer. They are very few. My brother, 70% of our members, okay, of nurses and midwives in Ghana, 70% are below the age of 35 years. Most of them are below the rank of senior nursing and senior midwifery officers. So by the current arrangement, they don't take full allowance. It's only the principal nursing officers and above. So if you go to those who wear green belt and those who wear move belt, and they are the only few people. How many are they? Very few. They are entitled to full. That's why I dispute that calculation that the minister churned out. And the full is not as though some are not being paid. It was 118 liters, okay. And if you monetize it, if you monetize it, it runs to at that time 100 Ghana cedis, 1,000 Ghana cedis a month. Now it's been moved to it's based on the export price, so like 1,009. The 1,000 is paid consistently as I speak with you. It's not as though some are not paid. So it's only the difference which is left. So if you go and do a computation as a sector ministry and you lump the 1,008 as if I multiply it by those who are qualified, you are being disingenuous, and that's why I dispute that calculation. The second one is uniform allowance, my brother, uniform allowance, and it is paid only once in a year, and it is just 1,000 Ghana cedis. That 1,000 Ghana cedis, initially it was 400 in the 2020 condition of service, and they paid 400 last year, so it is left with only 600 to be paid. The difference is what we are asking for, and it's a one-time payment for a year. I'm saying it's just for a year. Okay. The next thing that we talk about is book and research allowance, and the book and research allowance, my brother, only goes to those who teach at nursing training colleges. Not all nurses and midwives in Ghana. Okay, and it's also one-time payment. They found the need to put
one-time annual payment.
One-time annual payment.
Okay.
It's just like the uniform allowance. It's also one time. It's not every month. You can't buy uniform every month. So the uniform allowance, for instance, also is a one-time annual payment. Okay. Then we talk about rural incentive that will go to the underserved, our colleagues who are breaking their back at the villages and hard to reach areas. That has not even been monetized. So it was a committee was put together, and in that committee report, there are some proposals. Some are monetary, some are not monetary. And recently, Mr. Kando announced that they intend to give 20% of basic salaries. And my brother, when we say 20% of basic salary, the basic salary of some of the nurses is as low as 1,000 Ghana cedis, or 1,500 Ghana cedis. So if it is even 20% of basic salary, it's crazy. It's not 20%. So, for instance, if my salary is 5,000, it is not 20% of 5,000, because inbuilt that salary of 5,000 is market premium and those things. So it is just the single spine basic salary structure, a percentage of same. So sometimes this 5% of basic salary, 10% of basic salary runs to about just 100 Ghana cedis, 50 Ghana cedis, 30 Ghana cedis. It's nothing. It's nothing that we have to sit down and allow people to die. Either we are not doing proper computations or they don't understand what we are talking about. Another thing is 5% call facilitation. And I've heard some people say that call facilitation means that when a nurse calls a doctor to come and see a patient. Charlie, who taught some of these young journalism? Call facilitation means that by virtue of where I find myself, I'll work for 24 hours, or I'll work for my shift for 8 hours. And when I go home, I'll be called back to come and work. So, for instance, I'm a chip center. Those who are the chip centers, they work 24 hours. So even that 5% call facilitation is not going to every nurse. It's going to those who are at hard to reach areas and who, by virtue of where they find themselves, they are called after their normal shift Or maybe you are even in UGMC, you are working in the theater after your shift, they will call you back to come and, by virtue of being a critical care nurse, or maybe a ENT nurse, or maybe a perioperative nurse, something. And it doesn't work out for everybody. So my brother, there is and then 30 months salary. The 30 months salary is being supposed to be paid by the facilities. And that one is also one time.
The facilities
and
are supposed to pay
everybody.
The facilities are supposed to pay it from the IGF.
Absolutely. That was how they agreed. But in the implementation, we made it clear, in the course of the implementation, okay, with the previous, if you like, of the employer, before it was enchanted, we made it clear to them that by virtue of where nurses find themselves, don't forget that if you take other professions like doctors, pharmacists, and co, you won't find them in a chip center. You find them in some of them. You find them you find a doctor in the health center, unless well-endowed health centers in Accra and Tema and those areas. I hope you understand. So it's only necessary that you find them in those areas, and the amount of money they generate will not be enough. So, for instance, some of the psychiatric hospitals, if you go to Pantine Hospital, for instance, how much money do they generate there by virtue of? Because most of the patients there, of course, they are treated free of charge. So internally, they don't generate so much. Sorry. So we brought this to the attention of the employer and let the employer know that some of the facilities will not be able to pay. So in those areas, we could have a conversation for them to be paid from Control Accountant General. Okay. While those facilities who can pay, can pay. And if it so becomes burdensome, then because they made it clear that if it becomes so burden for a facility, the Control Accountant General will take it up. So these are the few items that we are talking about, my brother. It's not those long public sector allowances that is open to everybody. And you see, when you look into our condition of service, you find the category 2 and 3 allowances embedded in our condition of service. It doesn't mean that we are entitled to all of them. And that is why I cited the height allowance. How many nurses, if you're a nurse, which height are you talking about? Are we going to sit on the roof to nurse our patients? Something like a tool allowance. Tool allowance. Some of us, by virtue of what we used to do at the hospital, for instance, I was trained as a nurse anesthetist. I used to have my own laryngoscopes and my set of instruments that I carried to the hospital, because the hospital didn't have those sophisticated instruments, because I wanted to offer excellent and safe patient care. And that's my personality. And even that, we were not surcharging anybody. Look, as a head of department of Koforidua Regional Hospital Anesthesia Department for almost 10 years, you dare not charge a patient under my whatever. You understand? Because we are there to offer services. Government pays us. If we want extra money, go and do locum elsewhere. I used to do locum at Trust Hospital for 3 years. I would drive from Koforidua when I'm off duty to Trust and come and work there. Night duty, I'll be at Trust Hospital when I'm off duty at Koforidua Regional Hospital. If you want extra money, do that. But you cannot surcharge any patient for what services that you have been paid for. And some of us, when we were there, put our feet down, and people thought we were not even good managers because we not allow people to behave. Do you understand what I'm saying? So those two allowances and co. Maybe somebody is a carpenter or something, and there's a tool that he's supposed to use, and the facility doesn't have it. Maybe a biomedical engineer, he's supposed to service anesthetic machines. The hospital doesn't have those two set of tools, and then he procures his own tools and he's using it at the disposal of the facility. That is where that person is paid. That money doesn't come to a nurse.
Mr. Tinkorang,
grant.
Well, let's conclude on this news, and I guess you understand the concern of the Ghanaian when it comes to nurses going on strike, and the fact that and I realize that, and I'm sure you realize that constantly you're having to speak to the press daily on this matter, because when you go on strike, we can't wait for you to end it. That you understand the impact that this is making, and how perhaps you also need to maybe agree to meet government in the middle so this matter is sorted out for in the interest of a Ghanaian, right?
Yeah. So as I've said, that's why I've given you a blueprint. It's very simple. We are not saying that government should pay everything to us this year, but we will not entertain that deferment. So that proposal is shut down completely. We will not entertain it. It's amendable to us. We think that it's not tenable. I have brought a proposal. I'm saying that government should look at some of the items. For instance, uniform allowance, maybe the fuel, of course, and maybe the book and research allowance. We can look at it and then stagger the payment of the arrears. And that staggering can start from January. Maybe the following month we don't pay anything. The following month we pay something. The following month don't pay anything. The following month we pay something. Like that. We are reasonable people. And we will agree to come back home and come and work and save their lives. Look, my brother, life is important. It saddens me that we are doing this to the good people of Ghana. They don't deserve this. They don't deserve this. The employer must stop those tactics of deploying people, divide and rule. It will not work. Let me tell you something that people don't know. In Ghana, we have 128,000 nurses and midwives in Ghana. 124,000 sit on the public payroll. Okay, if you like, the government pays 124,000. Out of this number, we have 95,000.
95,000 nurses are your members.
I'm telling you, my brother, we have live data. Okay, we have an info. Everybody is there. Your name is there. As I sit here, I can send a message, and all the 95,000 people will get. Before we started this strike, one message, everybody is on strike because, I mean, they receive personal messages. So what I'm trying to say is that those smaller unions and co are brothers who the ministry are trying to use them as strike breakers. It will not work. Deploying retired nurses, they are even more annoyed. They feel disrespected by that call. And if you listen to Dr. Asante Krobia, who is also a retired nurse and a former president, the account is very clear. The verdict is very clear. Let us have a very constructive, open-minded dialogue that takes into consideration the economic interest of nurses and midwives in Ghana, and we shall overcome this mess we have put all ourselves in as a country.
Thank you. Thank you very much for speaking to us.
Thank you, my brother, for the opportunity.
Well, he joined us all the way from Helsinki, Finland, where he's actually part of I think, an ongoing conference. And, well, he's the General Secretary of Ghana Registered Nurses and Midwives Association, David TENKORANG-TWUM. And I'm sure you have been listening to him and exactly what is happening and how it will happen. It will continue to happen. Well, we'll be speaking to a few more people who are at the center of this.